Hi there. Hey, this is Kerry Duke. I'm with KCFrank.com. We are interviewing Rock Erickson with Pavilion Services. How are you, Rock?
Great. How are you?
I'm doing awesome. I'm really glad that you're here today, and we're going to talk about something that I think a lot of people don't know what it is, and you're going to help explain and demystify what it is that you do and how you help your prospects.
Sure.
Okay, so Pavilion Services, you're based out of St. Louis, correct?
Correct.
Now, what's your service territory? Who do you handle? How far away from St. Louis do you go?
Well, obviously our initial base is in St. Louis, but we service clients around the country. We're not
Okay,
limited.
so you're not limited by geographic territory.
No,
If they need your special help, they can get it.
absolutely.
All right, who needs your special help? Let's start with that.
Well, again, you get back into what is a management service organization? Well, it's an entity that's been created to provide management and administrative services to other organizations, such as physician practices or hospital systems or other entities. We are the specialists that might be otherwise difficult to afford. We bring a lot of expertise to the table.
Okay, so we're talking specifically then to doctors, doctor groups, and healthcare companies like what hospitals?
Correct.
Okay, all right. So these guys are probably familiar with management services organizations.
They are. Some people call it outsourcing.
I'm very familiar with that term. Okay,
We,
so
we are we are the people that they come to outsource when they really need some good work done.
okay, well we're dancing around this term MSO, Management Services Organization, and quote unquote good work.
Yeah.
What is the scope of services generally offered through an MSO?
Well, it varies by MSO, but we specialize on what I would call the back office functions of a physician practice. So, for example, when you walk in as a patient to the doctor's office, you see someone at the front desk, and they register you and present your information, and then you go back with the nurse to see the doctor, and then the doctor does what he's going to do, and then you get with the medical assistant again. You may schedule an appointment, anything like that. That's what we call the front desk. We do all the back office stuff. So, for example, first of all of those people have to be connected by IT. So we make sure all the connections are there, that the computer is functioning properly, that the software is there for their needs, and then we make sure that the software that they need is functioning properly, and that the paper flow, or in more and more the case, the digital flow is functioning properly. We work on the back side of all the stuff that the patient sees up front and make sure that everything flows properly. We work on workflow. We analyze how people do things, when they do them, and where they do them, and how they do them, and we try to make sure that it's optimized.
Now, when you say optimized, that kind of means a couple of different things from a workflow standpoint and from an economic standpoint. Are there are there reasons? I mean, what are the primary reasons that a company would employ, an MSO such as Pavilion Services?
Good question. Not everyone can afford the expertise that we offer full time. And so it's more or less like renting the expertise when you need it. And we provide it across multiple clients. And so if the physician practice doesn't have the resources to be able to fully employ let's say, for example, a coder, a certified coder, we can provide that on a limited basis. Again, it is cost effective to do that. Same thing with IT, same thing with our informatics, developing the software. Same thing with the administrative services, the even accounts payable, payroll, those sorts of things.
Well, let's break that down a little bit
Yeah.
because I'm a fifth grader,
Okay.
and I want you to make it brain dead simple for me to understand what you're saying. So if a you started off with saying that a lot of some businesses might not be able to afford your services,
Yeah.
but at the same time your services are expanding their opportunity without them having to hire somebody. So doesn't that make it actually affordable?
It does make it affordable.
So
Again,
they don't have to hire somebody full time for a let's say in your example a coder. They don't need to hire somebody, pay their insurance, FICA, and all that nonsense that goes with an employee,
correct,
including management. And they can hire Pavilion Services to take on that piece as they need it.
correct.
Okay, so that would mean that if they have people that are underutilized but overpaid, they could probably save money and use your services instead.
Absolutely. And we can perform according to their needs. If they need a job, just some focused work done, we can do that. If they need more continuity over time to provide an ongoing service, we can also provide that. We do turnkey services to provide the entire operation of a startup, for example, a new practice or a practice that's been affiliated with some organization and is trying to change it. They can come to Pavilion. We can help them succeed. We help doctors be doctors. Let them focus on the things they do best, and we do what we do best.
Well, Rock, I gotta believe that with all of the turmoil in the healthcare industry with these new laws being enacted, that it is a bigger headache than ever for companies and physicians to manage that process. And are you able to assist those guys with that?
Absolutely. It takes a lot of work to keep up with the ever-changing requirements of the government, with third-party payers, with just changes in personnel within an office. It's a big job, and we make it work.
So a doctor, just being hypothetical here, a doctor, can specialize or actually spend time being a doctor, keeping up to date with the medicine aspect of his business, while he outsources the keeping up with the laws and rules and regulations of his business to somebody else that can manage that.
That's correct. So when the doctor's out doing his work, say he's in the hospital, he's providing services there. And one of the great challenges is how does one capture those services so that they can be billed so that the practice can maintain their economic viability? And that's part of what we do. We help the doctor succeed in those environments as well as
Okay.
in the office.
Um, so if you were to describe the specific benefits to a prospect when they outsource, their medical practice, how would you define those benefits?
Well, we can again increase their revenue, we can decrease their costs, and we can help make their life better from
Ah, I
that
like that one.
perspective.
Making their life better. That's a real good reason.
That's right.
Because it doesn't, you know, look, I talk to a lot of guys, I talk to a lot of business owners, and one of the aspects that I find that they continually express as a frustration is that business is harder to do than it ever was before. And they got into business, maybe to fulfill some type of lifelong, obsession. I don't know, but at the end of the day, we want to make our lives better. And if you're able to help somebody else, run their business, maximize their profit potential, and make their life better, boy, that's the pretty good reasons to do business with you.
Well, that's what we try to do is provide a service that is of value. And I think people need to give us a try. We've got a number of very satisfied clients, and we want to expand that.
Okay. So how does a physician practice or organization, engage your services?
There are several ways. One, give us a call. There's a phone number, I believe, on the little byline down there. So you can call us at area code 314-880-6100, or you can email us. You can go to the website there, www.pavilionusa.com, and there will be a contact us section. It's easy, and we will be very responsive.
Okay. What kind of cost or fees are associated with your services?
Good question. It really depends on what the needs are. We meet with the practice, whoever the practice or the system wants us to meet with, to assess the needs. Once we've assessed the needs, then we can determine what the costs of that would be. And we outline it in detail so that there aren't surprises.
All right. Um, let's see here. Are your services centered upon a contractual time frame, or are they project based, or both?
Both.
Both.
Again, it's based on what the practice needs. We have clients that say, oh, we just need some help with coding, or we need some credentialing. That's one of the areas that a lot of practices have difficulty with, is keeping up with the credentialing, not only at the hospitals that they work at, but also with the insurance companies. And it's a big project. It takes a lot of time and is challenging. So those may be project based. Other times we will do an entire accounts receivable or revenue cycle management for a practice. And or we'll do the entire IT infrastructure, the wireless systems, something that a lot of the physicians really like from Pavilion is our cellular cell phone management. We take care of and help them keep their cell phones functioning. They drop their phone and it cracks, we can get the screens replaced. We can get substitute phones for them. We can help them get their programming set up properly. So again, it just depends on what the practice needs are.
Well, that leads into an obvious question about, how is there an assessment fee? I mean, because it sounds like you're going into a company and you're having to analyze what they're doing, analyze what they're not doing, analyze what their opportunities are for, both from an expense and a profit standpoint, and really, figure out how can they be served best. And is that process fee based, or is that process part of your consultation?
Generally speaking, we don't charge for the initial assessment. It's something that we need to be able to price it out properly so they can make decisions about what they want to do, what scope they want to have, and again, helps us better understand what their needs are so that we can eventually price it appropriately. So,
Oh, okay.
not necessarily a fee up front.
All right. Last question, Rock. As a small practice, and I have limited staff resources, how do you help me? I mean, because look, you first off said that maybe some businesses can't afford your services, but if I'm a small staff, small operation, how can I still take advantage of what you offer?
Well, one of the things that we do is make sure that the practice has the revenue they need. And so one of the things they need to look at carefully is, are they generating sufficient revenue based on the services that they are providing? And after they generate that revenue, have they captured it properly, have they billed it properly, and then very importantly, can they hold on to that money? And that's what we work hard to do, is making sure that once they get the money in the door, it's not likely to go out again. And what I mean by that is on government audit or third payer audit, or refunds due to errors and so forth. So it's something that I think we add value to even the small practices.
Awesome. Well, Rock, that's excellent interview. Here's my last opportunity for you to tell anybody who hears this where they can get a hold of you, how they can get a hold of you, and one last opportunity to say why they should.
Great. We can help you succeed. And the way you get a hold of us is go to www.pavilionusa.com or call us at 314-880-6100.
All right. Thanks, Rock.
Thank you.
We'll talk to you next time.
Very good. Thanks.